All right, let's talk about something that, everyone goes through, but nobody really wants to talk about. It's uncomfortable, it's disruptive, but understanding it is absolutely the first step to managing it. So today we're going to demystify diarrhea, from what causes that urgent feeling all the way to how you can keep it from happening in the first place.
We've all been there, right? That sudden, urgent, and just deeply unpleasant feeling in your stomach. But what's actually going on inside our bodies to trigger that alarm? Well, that's exactly what we're about to dig into.
So here's our game plan. We're going to start with the absolute basics. What is diarrhea? Then we'll look at all the different causes, learn how to spot the warning signs, and then, importantly, lay out an action plan for treatment. And we'll wrap it all up with the best part, prevention.
Okay, let's jump right into section 1. Before we can even get to causes or cures, we really need to get a handle on what's fundamentally happening inside our digestive system when it sends out this very urgent message.
Think of your intestines like a super efficient water recycling plant. Their main job is to pull water out of waste. Diarrhea is basically what happens when that system goes haywire. It either stops absorbing water like it's supposed to, or even worse, it starts actively pumping more water into your gut, which leads to those familiar watery results.
And this right here is probably the most important thing to remember. The discomfort, the cramping, that's not the real enemy. The true danger is dehydration. Every time you have a bout of diarrhea, your body is losing not just water, but also these vital salts called electrolytes that you absolutely need to function. For kids and older folks, this can get serious and fast. So, if that's what's happening, the next big question is why? And the answer is actually pretty complex. The triggers for diarrhea are all over the map. So let's get into section 2 and start identifying what can set this whole thing off. This table is a fantastic breakdown of the usual suspects, the infectious culprits. You've got viruses like rotavirus and norovirus, which you've probably heard of because they spread like wildfire. Then there are the bacteria, names you might recognize from food safety warnings like E. coli and Salmonella. And finally, you have tiny parasites like Giardia, which you can get from untreated water. They're all different organisms, but they all have a similar plan: to mess with your gut.
But here's where it gets really interesting. It's not always some invading bug. As you can see here, non-infectious causes are just as common. It could just be your body reacting to something it can't process well, like lactose and dairy. It might be a side effect from a medication. Antibiotics are a classic example, since they can throw your gut's natural balance out of whack. Or, believe it or not, it can even be a physical response to stress or a chronic condition like IBS.
Okay, so with all these possible causes, how do you know what you're dealing with? Well, your body has a pretty effective alarm system. In section 3, we're going to learn how to actually listen to it.
The immediate signs are, they're kind of hard to miss. You've got the loose, watery stools, of course, but that's usually just the beginning. You might also get those awful abdominal cramps, bloating, and just a general feeling of nausea. That sudden, gotta go now feeling is another classic symptom. And a fever? That's often a big clue that your body's in the middle of a fight with an infection.
Okay, now we need to shift our focus a bit, from just feeling uncomfortable to recognizing real danger. If you're not replacing the fluids you're losing, the symptoms start to change. The signs of dehydration are basically your body sending out an SOS, and they're signs you need to act on immediately. So, what exactly are you looking for? Pay really close attention to a dry, sticky mouth and feeling incredibly thirsty. You might feel dizzy or just weak, and one of the most critical signs is a big drop in how often you're going to the bathroom to urinate. In really bad cases, you might even see physical changes like sunken eyes, especially in little kids. These are not symptoms you want to ignore. They're major red flags. All right, so you've spotted the warning signs. What's the next move? In section 4, we're putting together our action plan, exactly what to do to fight back and get yourself on the road to recovery. The whole strategy is pretty simple, and it all comes down to one thing: fighting dehydration. Number 1, hydrate, hydrate, hydrate. Water is great, but things with electrolytes like coconut water or simple broths are even better. Number 2, you have to replenish those lost salts. This is where an oral rehydration solution, or ORS, is an absolute lifesaver. It's a scientifically balanced mix of salts and sugar that's designed to be absorbed super easily. And number 3, avoid things that make it worse. Stay away from caffeine and sugary sodas. They can actually make you even more dehydrated. Now, a really quick but super important note on medication. It can be tempting to just grab a pill to make it all stop,
But that can sometimes be the absolute wrong thing to do. Antibiotics, for example, only work on bacteria. They do nothing for viruses and can even make things worse. Other anti-diarrhea medicines should be used carefully, especially if you have a fever. When in doubt, just remember this. The number one treatment is always rehydration. So we've talked about how to react, but honestly, the best strategy is to not have to react at all, right? In our final section, let's talk about the most powerful tool in your arsenal, prevention. This is all about building a strong, healthy gut that can defend itself. And it all starts with the absolute basics of hygiene. I mean, it doesn't get simpler than this. Washing your hands with soap and water, especially before you eat and after using the toilet, that's just non-negotiable. Good sanitation and making sure waste is disposed of safely, those are the big picture things that protect whole communities. Next up, let's talk about what you're actually putting into your body. The rules here are simple, but man, are they effective. Always stick to clean or boiled water if you're not sure. Be really mindful of food safety, especially when you're eating out. And remember those little habits like keeping food covered and making sure your utensils are clean, they can make a huge difference. And finally, let's think about the long game. A healthy gut really starts with a balanced diet. For babies, breastfeeding provides this incredible natural protection. And key vaccinations, like the one for rotavirus, are one of the best public health tools we have for preventing severe diarrhea in kids. These are your lifelong allies in staying healthy. So it all boils down to this simple but incredibly powerful formula. Clean hands, clean water, healthy gut. The question is, are you protected? Taking these simple preventative steps is truly the most effective way to protect yourself and your family. It's knowledge that really is power.